When you feel confident, there's no better way to show it than with a big, bright, and beautiful smile. A smile can be the first step to a professional opportunity or an enriching personal relationship. Please welcome back our guest, Dr. David Kirkpatrick, a board-certified maxillofacial surgeon and an expert at restoring smiles for new teeth now. Dr. Kirkpatrick, how are you? Welcome back.
Doing good. It's good to be back.
You know, I always love getting to know your patients and how you've changed their lives. But so many times the people that you see point blank think that they have no other options and they're looking at dentures or other folks that wouldn't help them at all. Talk about some of the patients that you see and how they feel like they're at a dead end road. Yeah,
we have the three main types of patients that we typically see are people that either have a mouthful of bad teeth, a mouthful of severe periodontal disease, or just no teeth. And they're really not comfortable with their dentures or having a hard time with those fitting. But you know, with all three of those scenarios, we can take those patients and in one day place implants, whether they have teeth or not, and new teeth on the same day.
And then after that day, when you do those follow-ups, the benefits that you see in their lives. I'm sure you hear wonderful stories all the time.
Yeah, we do. And that's one of the cool parts about our job, that, you know, we get to know these patients because they're coming around for follow-up appointments. And then there's a time frame for the implants to heal before the final teeth and they're completely finished. But it's cool to get to know them and see the difference that it makes just with that one surgery day, that they walk out with new teeth that same day and hear like what a difference it made in their life with their just going out to eat dinner, you know, with their family.
Well, I gotta say, I can't imagine how exciting it is for you, because we enjoy hearing your testimonials, and I know today you brought one with you. Barbara Henry, as a matter of fact. Barbara speaks very candidly about her frustration with the state of her teeth prior to the procedure and how the staff at New Teeth Now put her completely at ease. Take a look.
I've lived in embarrassment for probably the last 10 years of my life. My teeth were they were falling out, they were loose. I just couldn't go another day. I happened to have on one of the local stations and the commercial came on. I ran over to my desk, got a pen and paper, jotted down the website, and finally one day I picked up the phone. And I actually talked to a girl, her name was Nicole, and I tell you what, she was this understanding, answered, I didn't really know what questions to ask. So she was just great, and it was almost as if she could sense my questions, and she was actually answering them before I could even ask them. I just felt so comfortable. I had dreaded in my mind of being so embarrassed to make this phone call. And the phone call was great. It was easy. Now, life is good. I made that phone call and I have the implants, and I'm thinking about other things. I'm not thinking about my teeth, so it's so easy. You just make the call.
Man, she remembers Nicole by name there.
Yeah,
that's got to be good for you to hear that about your staff.
Yeah, Nicole's going to be happy to hear that.
Well, I mean, there is part of a nerve-wracking experience. Some people don't like going to the dentist, let alone they're scared, I'm sure, to have a procedure like this done. What do you want to tell people out there before they make the call, and how easy you can make it on them?
I would say that our entire staff is well-trained, compassionate, and they understand that patients are scared to make that, or to take that step, or to make the call. And kind of like Barbara said, the hardest part of her coming in was actually making that initial phone call. And we hear that all the time. That's the biggest step. And once they come in and kind of know that we're real people and we can help them in a compassionate way achieve their goals and dreams with their teeth, then it's a little easier for them.
And I'm sure they wish they would have made that call even earlier.
Every patient will tell us, like, I should have done this like 5 years ago, 10 years ago.
And I will say, it seems like you guys do have other options too that you want to talk about. I know we've talked about a little bit about implants, we've talked about bone grafting. Kind of let's talk a little bit about the science behind what you're able to do all in one day.
Yeah, so, in the past, this procedure was done, like, if people didn't have enough bone, then you had to take bone from somewhere else. So you had to have an initial surgery just to prepare the area for implants. Now we can skip that with a lot of our New Teeth Now techniques. Especially, you mentioned the zygomatic implants. They anchor into your zygoma, which is the cheekbone. Sounds invasive, but it's really way less invasive than a bone grafting procedure that you can still do everything in a day.
Well, I'm glad you say it does sound invasive, because that's kind of what I was thinking, but I've heard several of your other patients talk about the pain element. And yes, you prepare them for pain, but so many of them are up and at 'em just like they were new again.
Yeah, and it amazes us too that, the patients will come in and, we prescribe a pain medicine, but it's routine for patients to tell us that, well, I took one because I was scared I was going to be in pain, but I never really needed it.
Well, we always appreciate learning about the procedures and how you are able to change lives, really, and make people happier. And, it's never too late to regain your smile and your confidence. So call today to schedule your New Teeth Now consultation. Plus, right now, there is a limited time offer to help save you money. So for more information, call 800-617-0609 or just visit newteethnow.com.